Welcome to all in our program Afomp organized International Medical Physics Week in 2021. Good morning, good afternoon, good day, wherever you are, please accept my greetings. For a consecutive second year, the IMP celebrates the International Medical Physics Week from 26 to 30 April 2021, dedicated to various professional, educational, and organizational aspects of medical physics. The main purpose of IMPW, International Medical Physics Week, is to innovate organization of activities in a defined way that result in the promotion of the subject of medical physics globally. Afomp is very happy to support IOMP in this initiative and organizing today's 28 April 2021, a webinar program with 4 international expertises in this field. The speakers are from different countries in the whole world. They are from Germany, Italy, and China. You will see here our scientific schedules, who are the speakers. It will talk in different topics, what will happen in the COVID-19 pandemic in the role of the medical physics, what are the challenges faced by medical physics, and also to raise the awareness program or to strengthen the community of medical physics. It will be also speak from Italy speaker, and then lastly, you will know about the medical physics education, accreditation, and certifications. I am very hopeful that all the speech by the international expertise will help you to promote you. The young generation will go further in this field. Now, I am requesting Professor Arun Chagle, the president of Afomp, to give a welcome speech. Please, Arun Chagle.
Thank you, Professor Anupama Azhar, for the introduction. Dear participant and the invited speakers, thank you very much for joining these things. Accept the greetings on Afomp and from IOMP on this International Medical Physics Week. As you know very well, medical physicists are health professionals, but they are not very well recognized in many countries. How to make them visible, how to bring into forefront was a task in front of IOMP, and to do so, we have started International Day of Medical Physics since 2013, and it is celebrated on 7th November, the birthday of Marie Curie. However, it was found lately that one day in a year, IDMP and celebration is not going to help much to bring the medical physics contribution to healthcare and showcase their work and contribution. And therefore, it was thought that why not to have a 1 week as United Nations, many 1 weeks are devoted for different professional, different activities. And that thought has come up that midway between the International Day of Medical Physics, we should have 1 week devoted to medical physics to popularize the contribution of medical physics to the masses, to the public, to the media, to the policy decision takers, because this subject, this field is not very well known still amongst the healthcare workers also. And that is how we started in 2020, the International Medical Physics Week, and it was celebrated during 11th to 15th of May 2020. Unfortunately, we could not achieve the objectives of this International Medical Physics Week, and the objectives were to reach to the public, to reach to the masses, to showcase the contribution. Because of the COVID pandemic, the meetings or the rallies or kind of webinar, seminar in person could not be held. And we were hoping that at least in 2021 we'll do so. But unfortunately, again, this pandemic, we are not able to do it. And this year, the IMPW is being celebrated during 26th to 30th April 2021. And across the world, many seminars, many academic activities are being held. And it was thought that being a regional organization, one of the largest regional organization of the IOMP, Afomp, should do activities. And thanks to Secretary General Dr. Professor Anupama for taking this initiative, and thanks to Dr. Professor Franco Milano and Holker Still for and Jin Xians to accepting to deliver this talk. So during this 2 hours session, we'll have 4 talks on different topics, how medical physicists are contributing, what are the challenges, and what needs to be done in this direction. Lot needs to be done in this direction because our profession, the number is not very large. If you look at the entire medical physicists in the IOMP across the world, the number is around 30,000, though we need almost double the number, 60,000. If you look at the Afomp, which was founded in 2000, and we are celebrating the 20th anniversary of the Afomp, various activities we are carrying out. Even in this area, we have allowed about 10,000 plus medical physicists for a population of 4.7 billion. 60% of the population of the world lives in the Asia Pacific, the Afomp region. Many countries yet do not have the formal medical physics education training program, the residency program. Lots need to be done. Also, the recognition what we need as a health profession, because medical physicists are recognized as a health profession by ILO, by WHO, IAEA, and many other organizations. But the status, the respect deserved because of our contribution to the health physics is not there. And that is what we are want to celebrate this week and to reach out to the people. But due to pandemic, as I said, it wasn't possible to organize public meetings or public things going to the different schools, colleges, or media. And that is how we are having this webinar. Once again, I thank you for joining this efforts of the Afomp to celebrate IMPW. Thanks to the invited speaker, thanks to all the delegates participating in this event. With these words, I hand over the floor back to Professor Anupama Azari.
Thank you, Professor Chokle, for your nice welcoming message. As you know, in the IMP President, Professor Dr. Madan Rehani, for the time differences, he cannot join in lively. So he has changed his video message to us. So I am just waiting for this thing. Please hear the IMP message.
At the outset, let me thank the leadership of Afomp for inviting me to talk about the IMPW. We have many forums to give talk on the scientific subject, and that is what we do all the time. However, today I am going to talk to you about the IMPW as to what was the basis when we started this IMPW, the International Medical Physics Week. We all go through set pattern in our professional life. We start in our career and our ambition is to talk about our work in national forums, national conferences. And then from there, we want to extend to the international arena. We make publications. So, but within all that, the basic point remains that we are talking to our own professional colleagues. that is the medical physics community at large. Many times we feel that we are talking to the same very people who already know the subject. And sometimes we get a feeling that we are feeding those who are already well fed. And when we sit back and listen to our own self and try to analyze the situation and see whatever we are doing, how much of that is helping others. And then we analyze who these others are, that translates us from our own self to our specialty. So it's a translation which happens, that we want to now promote our own specialty when it comes to others. Who are these others are? Initially, we started with talking to our own medical physics fraternity, whether at the national level or at the international level. Then we want to include the beneficiary of our work. And the very first in that list comes the patient. So we develop programs to reach out to patients. And then when we see that there are large category of medical professionals who are the one who are beneficiary of our work, or who can be the beneficiary of our work as medical physicists, and then we want to reach out to them, be it cardiologists, electrophysiologists, vascular surgeons, or doctors doing fluoroscopy outside the imaging department, even the physics faculty in the university, how much they really know about the medical physics, how much they are wanting their students to get accustomed to medical physics, oncologists. So if we keep on seeing the list keeps on growing and growing, and when we look at the work of billions of X-ray examinations being conducted annually, or millions of radiotherapy treatments, millions of nuclear medicine examinations, so we feel that there's a large spectrum of people, whether it is professionals, patients, or member of the public, who really need to be reached out to make them know what medical physics stands for. And that is where we feel that we need to develop tools and use tools which we have not been using. And that is what created a realization in me. I felt that the common tools which we have of participation in conferences, talking in conferences, programs, and all that covers only a very tiny fraction of the people whom we want to reach out. So we should have more and more audience. So to increase this audience, we first developed IDMP, the International Day of Medical Physics. And with the success of that, we felt that we need to further extend, because IDMP is not adequate forum to reach out to the very large audience we have. We thought, let us create the International Medical Physics Week. So with that thinking, we have created the IMPW, and it will be good if we extend our audience, our activities to larger and larger audience. I can tell you this is something which every profession is facing, whether it is biochemistry, oncology, or even any subject in medical. They are finding it hard to reach out to other specialists. Other day, I met a journalist who worked with me sometime when I was at the IAA, and when he is now retired, he has opened a organization, an NGO kind, to let journalists know more about the nuclear energy and nuclear field. So he feels there is a lot to be done to create awareness among his journalist colleagues. So everyone is facing this challenge to reach out to wider and wider audience. And with that, we feel that IMPW and IDMP should be used to reach to the wider and wider audience. And with that, I thank you for your patient listening, and thanks the organizers once again for giving me this opportunity to express my views on the IMPW, and wish you a happy celebration of IMPW 2021.
Anupama? Lost connection.
Oh,
Yeah.
okay. Thank you, Professor Dr. Madan Rehani, for your very stimulating and encouraging speech to the participants, through which we can understand why Medical Physics Week has been started, why the organization, different organization, national member organization, regional organization are telling to do these things. And we are happy that many participants and at the same time many organizations are celebrating this week, so the participants are divided in many areas. So we are going to start our main programs, the stimulating lecture from the international expertise in this field. Now in the scientific schedules, if you have seen, that's our first lecture will be Dr. from Jiang Xin, who will speak on medical physicists in the COVID-19 pandemic. So I will show about him, that he's about a short biography. I think it is seen, isn't it? Is the Dr. Jian Xin, Associate Dean of School of Basic Medical Science, Chief Medical Physicist and Director of Radiotherapy, Center of First Affiliated Hospital, Wenchao Medical University, Wenchao, China. He is the Chair of ETC of Afomp, Associate Editor of the Journal of Applied Clinical Medical Physics, JSCMP, and Technology in Cancer Research Treatment, TCRT. He also acts as a Vice Chairman, Radiation Oncology Committee of Zhejiang Medical Association, Radiation Oncology Branch of Wu Zeping Medical Foundation, Zhejiang Anti-Cancer Association of Radiation Physics Technology Group. He also acts General Secretary as well as Vice Chairman of Younger Committee of Medical Physics Branch of Chinese Society of Biomedical Engineering. As he is in the traveling, so he sent his video to run in this program. So I'm showing you the video.
Ladies and gentlemen, this is Xian Che
Anupama, you have to stop this first sharing because this still the program, scientific program is there. Just unshare that and then share the video. It's not visible.
Ladies and gentlemen, this is Xian Che from Wenzhou, China,
visible.
from the Wenzhou Medical University. Thanks for the organization and the invitation from Professor Hassan Al-Palma. I'm very happy to attend in this International Medical Physics Week and to show you something about the Afomp guideline and the medical physics during this COVID-19 pandemic. Currently, the global COVID-19 pandemic is still very serious. According to the WHO dashboard, as we can see, the confirmed case and the deaths is still rising rapidly across the world. Thanks to the efforts of the Chinese central government and the Chinese people, China had controlled the COVID-19 basically. Though the confirmed deaths is about 4,800. I'm come from Wenzhou, China, the southeast part of the China. So at the beginning of the COVID-19 outbreak, actually Wenzhou is the second serious city that affected by the COVID-19, second only to Wuhan city. So we have a total of 504 confirmed cases and 1 death. With the outbreak of COVID-19, the city Wenzhou is locked down quickly on January 29, 2020, but it will open soon on February 19, 2020, after 20 days of lockdown. And there's no new case reported since the February 18, 2020. As you can see, this is the site of the city lockdown during this pandemic. After the reopening of the city, there are some stricter measures people need to follow. People going outside are required to wear masks, and the temperature taking could be happened everywhere. So there are government offering some coders. If people who went to some risk areas, their code will be yellow or red. Only the people have the green code, they can go outside freely. Our radiation and oncology department resumed the radiotherapy on 3rd February 2020. It's about 4 days behind the normal schedules. But during that time, the whole city is still locked down. So the medical staffers and the patients need to wear special passport in order to visit the hospital to take the treatment. According to some studies, cancer patients appear to be at increased risk of COVID-19, and the outcome of the cancer patients who infected by the COVID-19 are worse. So they are more vulnerable to infection due to their compromised immune system. And basically, many cancer patients are elderly and more susceptible. So due to these conditions, the Afomp decided to publish a guideline on radiation oncology operation during the COVID-19. During this guideline, we need to deal with the complexity of the radiotherapy department. So we have different people, so like cancer patients, family members, doctors, nurses, and therapists, medical physicists, and other maintenance engineers. So this is really a complex situation for the radiotherapy department. So that's why our guidelines to how to first we need to set up a general management. So we need to establish a coordinated unit to arrange the whole department. We need to establish excellent links and reporting lines. So in case if there are some patients in favor or we have confirmed the case, where to report and who to report. So we develop general rules for prevention and personal behaviors. The medical staff was split into different groups. So in case there's one person in one group affected, this doesn't affect the running of the whole department. We also establish a triage procedure at the entrance. About this triage, so we have two levels of triages, like hospital entrance and the department triages. So basically, during the triage, patients will be asked, have you been to Wuhan for the last 14 days, or do you have a close contact with someone from risk areas or other symptoms? But this Wuhan could be changed. Actually, China was suffering from the second outbreak during the end of last year. So the place will be changed to Xinjiang or Jilin, someplace else. So the patients were asked to wear a mask and they need to keep social distance. We have a clearly demarcated waiting areas for the febrile patients, and the patients were well informed, educated during this pandemic. During their hospital visits, the staff will tell them where to wait and where to report when something happened. For the staff member also, we need to get them good information and educate them how to cooperation, how to connect to each other. we need to provide a good protection from our medical staffers. The schedule are usually be rotated among these staffers. As we said, we will split the staff into different groups. So we try to limit the mobility and a crossover during this department. Most of the time, we will ask them to using the social media for work instead of with the hospital is work in hospital inside. As for the protective equipment and the levels, we will manage this according to different staffers according to their work, like radiation therapist, radiation oncologist, and the medical physicists and the triages. Different level are protected. So the protect level are according to the working environment. Like you are working in the hospital in an area that like less risk, or in the infection department or our radiation department is different. Also, it depends on the availability available of the protective staff. This is very important at the beginning of the outbreak, because at that time we are short of some of protection
Staff, authorized
materials,
representative of
so
radiation
different
protection,
levels are
head
separated.
of Department of Medical Physics and Radiation Protection, Impw
Infection measures
Center,
are strictly
enhanced,
followed, so like
Denmark.
treatment equipment, simulation equipment. So this should be disinfected twice a day, and if any time there's a contamination occurs, the treatment will be stopped and should be cleaned up first. The ground disinfection, all the office room and the treatment room. If you have see some visible pollutants, you should be cleaned first. Also, it follows twice a day, and stop anytime their pollution occurs. We also buy some air disinfections in the treatment room, in the waiting room. So especially the treatment room, they should be disinfected at the end of the day. So we're providing circulation air disinfectors for continuous disinfections. You also like say ultraviolet radiation for 60 minutes at time 3 times a day, like morning, noon, and after outbreak. During this COVID-19 pandemic, all patients regarded as infectious medical visitors. So it should be follow management of medical visitors, and there are some protective equipment for exam directly discarded after examinations. So usually double layer sealing and clean marking and airtight transportation are required. So if you have a brachytherapy unit, there are some general conditions you should apply, and you should reduce the number of procedures fractions. So all the team member, so all the staff should be split into different teams to avoid infection of all team members. So you need to management how to exchange the source. So loose activity restrictions and close cooperations are linked. The pandemic is not only affect the radiation oncology department. Basically, it has a great effect on the world economy. It's been reported that world economic activities is about to decline by 1.9% in 2020. With the United States, Eurozone, and the UK will be down by 3.3%, the 4.2%, and 3.9% respectively. China maybe is the only country that have been recovered from these effects on the world economy. But the global recession, its annual growth will still be below like 2%. It's not like normally 6 or 7%. On the other hand, the COVID-19 has greater disruption of the education system. There are about 192 countries have been closed down their schools and the universities. This disrupted the education of nearly 1.6 billion learners, which accounts for about 94% of the world's students' population, and up to 99% that was in low and lower median income countries. So as the medical field is also affected by this COVID-19, and there are no physical meetings across the world. So in this case, the Afomp, the Education and the Training Committee of Afomp decide to provide some online webinars for our medical physics communities to keep us our continuous learning. So before each webinar, we have a preparation meeting, rehearsal meeting. The ex-cons will discuss the preparation of monthly webinar. So this education and training community will closely cooperate with the science community and the professional development community. So to offer some continuous education points. So pre-webinar meeting, we will have discussed with the speakers and the moderators how to make sure the webinar will go smooth and the audience get valuable informations. So this to show you some the first webinar. So was talking by the Dr. Lunsky and Dr. Thomas Kohn from the Australia. They talked about the total body irradiation. So this is show you the live webinars. It's about average over 200 participants every webinars. Usually there are very hot discussions during the question and answer sessions. You can see. We have well scheduled the Afomp 20th anniversary webinars from the June 2020 to June 2021 for the whole year. The time for the webinar was every first Thursday of the month, like April should be April 1st, and May will be May 6th for the first Thursday of that month. We also had a cooperation with Medical Physics for World Business to discuss about the Afomp guidelines about during these COVID-19s. We also write a book about the medical physics during the COVID-19 pandemic, which was edited by the Dr. Kwang from the Malaysia. We Asia Pacific region was writing the chapter 8 about the medical physics during the COVID-19 pandemic from the Asia Pacific review, about talking about the contribution of medical physics and the education systems, education situations, about the training and the research activities affected by this COVID-19 for the medical physics societies. So in conclusion, this is a battle between people and the virus, and we are not sure when can we win this battle. But during this time, we should protect the staff of all the peoples, including medical staffers and our patients. But at the same time, we should move forward with colleges. We human people will finally defeat the virus. So radiation department and the medical physicists encourage people with our safe productions and increase the economic incomes for hospital during that time. So that's all. Thank you very much.
Thank you, Dr. Zian Sin, because he has shown clearly the things what we are doing on behalf of Afomp, the COVID guidelines, and also shown what are the measuring taking place in China in your hospitals. And also, as we know, China is from Wuhan, the COVID-19 pandemic is originated. So now we are going for our next speakers, Dr. Volker Style. I'm just sharing his CV. He will tell about the challenges faced by medical physicists. Just a minute.
No, you have to unshare his CV.
Yeah. What's happened? Okay. The Volker Stein, he is the authorized representative for radiation protection, head of Department Medical Physics and Radiation Protection, University Medical Center Mannheim, Germany. He is fully licensed as medical physicist in all disciplines of medical physics, like radiotherapy, nuclear medicine, and radiodiagnostics. Since 2020, he is serving as a head of the Department of Medical Physics and Radiation Protection, actually 14 licensed MPE and 4 MP on training on her under her supervision, and responsible for radiation protection in this hospital. He is also expert awardee of the German Medical Physicists Association DGMP in 2020. Since 2008, he is acting as a lecturer master's course on biomedical engineering at University of Heidelberg. He is the member of German Medical Physicists Association DGMP. He is the member of German Radiation Oncologist Association DEGRO. He is the board member of the Committee of the Certification of Medical Physicists in DGMP from 2033 till 2010. Member of the German Commissioning on Radiological Protection from 2011 and 2016. Since 2013, he is the project coordinator of promoting the quality of medical physics education in Bangladesh and South Asia, a project of the German Academic Exchange Service DAT between the University of Gano Vishwavidyalaya, Bangladesh and University Heidelberg, Germany. So I'm requesting Volker Stein to share his PowerPoint to the participants. I'm requesting all the participants to mute because there is so much noising we are hearing. So please mute yourself, and also please, we will take all of your questions. Please put in your chat box. We'll take all of your questions after end of the 4 lectures. Thank you. Please carry on, Mr. Volker Stein.
Yeah, thank you very much for giving me the chance to talk about this topic here. I will go through, and I will start it now. Here is where I'm coming from, the University Medical Center in Mannheim. It's the size is about 1,200 beds, and we have 5,000 employees. To give you an introduction of myself, I passing now at three different hospitals are passing the whole development from 2D to 3D to step and shoot IMRT and VMAT, and I will show you later on, and I will be luckily happy to be also part of this next step what I try to figure out. Yeah, the global challenge is everybody is knowing this, and you see there is a growing of cancer patients over the world, and you see there's a lack of treatment capacity. I'm focused only on radiation therapy in cancer treatment. So you have a lack of treatment machines, of treatment capacity in general, and if you stated the expanding of the irradiation capacity in the so-called low and middle income countries will lead to a demand for well-trained personnel there. But this is a proposing, because if there is no expanding of treatment capacities, there will be no need of staff. So if a country has no money to expand the treatment capacity, then the possibility for establishing especially medical physicists to take care about this infrastructure is also low. Another interesting topic is a reason for medical tourism. There was a poster in Astro last year, and you see the most important reason for medical tourism are the reliability of medical devices or services in the visited country, and the absence of reliable medical services locally. patients face significantly financial burden of their cancer treatment. So at the end, you have a money drain out of the home country. Are there challenges faced by medical physicists? Yes, a lot. And but I can talk. Of course, I couldn't talk about all of them, but I would like to focus on 2 items regarding medical physicists. I would highlight the education and training situation, and I would talk about establishing an international standard. So you all know the EIR status that clinical qualified radiotherapy medical physics must have a university degree in physics, engineering, or equivalent physical science, appropriate academic qualifications in medical physics or equivalent at the postgraduate level, at least 2 years full-time equivalent structured clinical service in clinical in-service training undertaken in a hospital. That means you couldn't get a medical physicist only by studying. So I think one problem is at the end of a master's course is to find, but this is what we have heard from Professor Schockle in the beginning. You have to have at least 2 years full-time equivalent structured clinical in-service training, and you have to find a hospital to do this. The implementation of framework conditions for qualification is a country. If a country has no national legislation on the use of ionization radiation on humans, can therefore either adapt and recognize them from other countries with legal regulations. And to give you an example on that, Germany has a cooperation, has made a cooperation with a country in Central Asia. And one of the topics is to establish in the health area what they call German standards. So this would be a possibility to have. This country has no national legislation, and there will be adapt some rules and some guidelines from Germany. Or the other point is you could establish an education and training program according to the requirements of the international organizations, the EIR and the IOMP. And therefore you have, upon the successful completion of the program, this organization will issue a certificate of qualification, and this certificate is then accepted by this country as a qualification as a medical physics expert. So these are the two situations. These are the organizations who give you support. I could also say the AAPM, the American Association of Medical Physics, have also a well-structured residency program. But on the other hand, a master's course in medical physics is a very good starting point to establish a education of medical physicists. And coming back to this country in Central Asia, they have a minor treatment capacity, but they have a national cancer plan, and the government is willing to increase the number of treatment machines. So they are now in a situation that they have a decision to do this, and the question is then how they will reach the goals. Another thing what we had, as I said, is master's course in medical physics is a very good starting point. We refresh a DID project from Germany and Bangladesh 2013, and the core of this program and the success for the grant was that we had a partner university with a medical physics master course. And this is where we built on our program. We start in the very beginning. We start by improving the infrastructure and quality of teaching. We gave support for training visits of local medical physics expert in Germany. We were able to support PhD theses. We could help by the establishment of an infrastructure for e-learning. And this e-learning program went live, and fortunately, direct before the Corona pandemic. To see here, this is the second phase of the program. This was 2017 till 2021. So, and there we were able to put in the contract with the DAAD a promotion of as a south-to-south expansion, and for that on this. But the basic of all this improvement were the master's course under direction of Professor Anup Azari, and under the continuous what we call non-retirement support of Professor Zakaria. We are now in a situation to look beyond 2021, and the DID would be able also to define a north to south expansion. You have seen in this slide, we got the south to south expansion. So we did some workshops also in South Asia, and we can now bring it to a north to south expansion. And what we want to try to establish is a network of letters of intent between universities and the University of Heidelberg to expand the DID program further in South Asia and Africa. How does this work? This project this is an academic program, so you need a partner university in a country to expand this in terms of South Asia or to Africa. At the first step, 2 students from Rwanda has successfully passed the master's course medical physics in March 2021 at the University Gono in Bangladesh. We tried at first in the first phase, we tried to bring students to Germany, and we have done this, but the cost of life in Germany are very high, so that's a challenge for the students to stay in Germany. Challenges faced by the medical physicist, let's say the attempt of a conclusion to education and training. There are a lot of ongoing initiatives to improve the present situation and education situation of medical physics. Today we have another great initiative for that. Basically, that's excellent for medical physicists. But radiation therapy is an interdisciplinary treatment of cancer patients. This must be also taken in account when improving education and training. Let's come to my second topic: establishing international standard. For establishing international standard and improvement of cancer patient care based on a national cancer plan as a government decision, I gave this example in the beginning, is a very good starting point, because otherwise you have no long and mid-term plan what's going on in the country and what is the development to which point, from which point to which point. So this is a complete individual list. So I sit down and said, what does it mean establishing an international standard? This starts with awareness and screening programs, improvement of pre-therapeutic diagnostics, interdisciplinary tumor boards, treatment decision on actual scientific level, documentation of treatment standards in standard operating procedures. Then we are coming to the points where medical physics are involved. Start of therapy after the diagnosis with a minimal delay without waiting list. That's a question of treatment capacity. Treatment of the whole treatment series without any break is what is called a backup concept. That is also a question of treatment capacity. And what I'm highlight in the middle of that is about the transition from mainly palliative to curative treatment concepts. What is the adequate technical equipment to take such a step? This is one question. And is a longer transition process from 2D, 3D conformal, IMRT, VMAT, and necessary. That's a question of palliative to curative treatments is to look, okay, what is the technical equipment? And that would be hard, is impossible, for example, with the cobalt machines. Standards of target definition and related margins. So when we are focused on this one, where the medical physicists are involved, we have from a point of view of the medical physicist, this development, and this is my personal experience, will be increasingly characterized by the keyword managing a system. So in the past, or I personally, I told you a bit about my history. All physicists coming ahead with the what is the challenges we will face in the future. All physicists, they're defining their professional life only by doing treatment plans. This will be, let's say, this will be a position that is not covered by managing a system. What does it mean? That's a segmentation of information, transferring information from analog to digital. That is a very important point. You have network management of several powerful, huge software packages. So you have here as a keywords updates versus upgrades. You have to take care about the manufacturer's hardware warranty, and you have to look, and you have established improved system tests to eliminate systematic errors as end-to-end tests after software updates and software upgrades. That is really important, and this is our let's say managing the system. And so we have 4 machines on site, 2 machines in 2 different satellites, and everything is connected to an electronic system. And we spend a lot of time, and we have a lot of personal capacity to keep this system up and running. And now we are going to replace all the 6 machines within the next 1 to 2 or 3 years. So we are faced with a challenge, and this challenge is called artificial intelligence. So coming back to these highlighted red items in the beginning of this part. Will artificial intelligence and deep learning solutions help to bridge the gap between 2D, 3D, IMRT, and adaptive radiotherapy? So, focusing on the treatment planning part, you can say, okay, there are programs to support you in the core process of treatment planning, the contouring, the target definition, and the treatment planning. This you could have support by AI modules. So we have made our own experience with AI, but AI with own image data. That's a big difference. So we trying to use synthetic cone-beam CTs for retreatment planning and adaptive treatment, and we have trained the AI algorithm with our own data. but it was still a given AI algorithm. We have established an MR-only treatment planning workflow, though we transfer, also supported by AI, MR images to synthetic CTs, and then you could pass by the treatment planning CT, and you only use the MR data set, and this is described how it works, and it's also based on the AI algorithm. So these image. So my I could estimate that in the next few years, this core process treatment treatment planning will be increasingly automated on the basis of AI. This is what I want to say when my first statement to say medical physicists, they are only focused on treatment planning, will be not up to date at that time. On the other hand, is you could ask, what's about these AI modules? What's behind this process? And these AI modules, how they are working, and on. These are new challenges to say in the whole process, in the whole delivery process. Someone has to take care about what's happening in these black boxes. Establishing a new international standard. Yes, will artificial intelligence deep learning solution help to bridge the gap? I would say not in one step, because AI couldn't replace training and education of the staff on all levels. Up from a certain level, AI could give support to shorten the transition phase. And the models for AI based on your own data, would you intend to use models for AI based on your own data, or you will buy it and use it as a black box? And there is also development as a use case to say, okay, the companies offers this, and this, you pay per patient, per treatment plan, and so on. So there are other challenges behind that, but at the end, greatly improved system tests as end-to-end tests, including the AI part, will be necessary, and this will be one of the, from my point of view, will be one of the big challenge for this in this area. Yeah, medical physics in radiotherapy 4.0, is this a window in the future? Not in this extent, because they will still be integrated in a clinical team for patient care. And therefore, sustainable improvement will only happen if it affects the whole team, including the radiographers and, of course, the medical doctors. Yeah, thank you for listening, and greetings to Sri Lanka. Thank you.
Thank you, Volker Stahl, for your nice presentations and the current topic on AI. And would you please share your screen off? And we can understand that in the coming years, how the AI can do the without gap between the adaptive therapy, 2D and 3D therapy. He shows nicely that in education where we are challenging phases, as well as in hospitals. Now we are going to have our next speaker. I will ask the participants to put your question in your chat box so that we can take all the questions in the time. Okay. Our next speaker is Professor Frank Milano. He will talk about the awareness, to raise awareness and to strengthen the community of medical physics certification. So here you see his things. He is the professor of University of Hospital Florence and also University of Catania, Italy. He acts as a visiting professor in University of Plovdiv, Bulgaria since 1996 to 2005. He also acts as a visiting professor in University of Sumy State Technical University, Ukraine, till today from 1996, and Chulalongkorn University, Bangkok, Thailand from 2005 till today. He is the member of different professional activities, AAPM, IPEM, ASTRO, and AIRP. He is the honorary doctor of Sumy State Technical University and Riga Technical University, Latvia. He has done many international cooperations with University of Florence, with University of Sumy State Technical University, Chulalongkorn University. He acts and also works as an audit team of a Quattro IAEA project from 2008 to 2012. He works in IAEA in TCAP project from 1995 to 2011. His main research topics is ionizing radiation dosimetry, imaging technique, NMR protection, radiation protection, radiotherapy, and radiology equipment. He acts as a lecturer from 2000 to 2006 in Belgium in Astro different training course on physics of radiotherapy in Belgium, Turkey, Russia, Poland, and Australia. He has many publications and research in his life. So I will request Professor Frank Milano to share your screen to show your presentation.
Okay, it's okay?
Yeah, it's
Good you
okay.
have.
Yeah, it's
Good you
okay.
have.
Okay.
I appreciate a lot of the talk of Professor Stale because it's very, very stimulating, and surely there is some overlap with my approach. And we celebrate IMPW week for the second year. Of course, it has been a tremendous year, it's clear, and we will be in this critical environment for many years. I hope no, but it will be the truth. Let me. Very often in Italy, out of Italy, we've heard, read, thought that nothing will be the same as before. And I fully agree. And we had not to forget this. My question is this one. When we are celebrating our role in the society after this experience, what does it mean? This means that we had to celebrate the awareness of our role or to strengthen our idea of community. Because I'm convinced that to be professional in medical physics is like to be in a large community. And probably the experience we have made stress out this be a community. Okay, it's so I will skip out the impact of our profession in the cure that has been obliged to give to the patient during this pandemic, and I will stress a little bit what could be our community for the future. And probably a large part of what could be our community in the future has been given by Volker in the previous one. And let me see. I was wondering, and then I went to give a look in a blob. Well, a blob are a little bit dangerous because in the web you can find everything. Anyway, I find that someone, VP Thomas, I don't know him, just making search in the web, he found eight aspects that are not negative in our experience. And I circle by red circle what I think we will keep in our experience, and they will be very present in our future as a community. Education become digitized and affordable, of course. Remote working turning mainstream, yes. A new wave of tools and software and innovation, and to stay connected and help each other. Think a little bit, 4 years ago, how many webinars have you followed? Probably zero. But how many webinars you are following nowadays? A lot. If the number of people attending our celebration is not so large, is because we have in parallel many webinars, and so it's not a weak point of our presentation, but is simply to take care of the real situation. Anyway, nothing will be the same. What does it mean? This means that we will use in the future remote working as much as possible, and learning and collaborating on the net. And here you see the symbol of the software we can offer. So it's very simple to say that we spare money because we don't need to travel, but this is very trivial approach. Anyway, we had to change our way to make training and to make education. Why? Because it could be very easy to take advantage to mix the different professionals. So we have a kind of biodiversity, which is a value in our professional. Here you have, I found that someone make a search. There are hundreds different software, and are the best one, and some other. You can do many things. Of course, I am in favor of lecturing in presence, but anyway, if we find the right cooperation between some person in another university or active in the field, it can bring easily his help to increase the profession in some country. And what could be very important could be to have a kind of homogeneous approach. What does it mean? This means that we cannot be teacher only long distance. So we need to have a strong integration with local teachers. Sorry. Here is something which is personal. What you see, just in the center, you see a picture which is very historical. 1983, John Cameron came to Italy, and he tried to have some help to lecture, to have a kind of seminar. And so my boss and me, it's here, we stay 1 month, full immersion together with these people. You see this person, this is Professor Fuan. You see this person, she's from Indonesia. Many of these persons have become leaders in their own country, and they will become very important. I met some years later Kwan in Italy. I met Kwan in Kuala Lumpur in 2004. What does it mean? We have become friends, and I am friends for many of these. And this means to have to be in a medical physicist community. I have been lucky to stay not only in this kind of training, but also in the College of Medical Physicists. And you see how many of them you can find probably also yourself. I don't know if he's attending. He is from Bangladesh. There is where is Arun? Oh, anyway, somewhere. Anyway, please consider that the community of medical physicists exists, and it exists since many, many years. One point is that we will not lose the need to have long distance training. When Professor Volker say we are just looking for standardization and recognition, we are facing the same problem. So I am sure that in the future, in any international organization of medical physicists, long distance training and education will be strategic. If we consider the role of Afomp, probably this organization is one of the biggest organizations. You see, you have a lot of national members, but what is also important is the number of population that are inside this organization. Not only the number of members, active members of the individual society, but also the number, because I'm sure that historically the Anglo-Saxon world is a world that is a leader in many, many activity. But I'm convinced that many activity in the future, economics and also scientific activity will be in Asia, And so it becomes very, very important that we can find a good training in this country. We have in IOMP a education and training committee, and the committee this committee start in 2018 and will end in June 22 because of pandemic. If you give a look, you have 1, 2, 3, 4, 5 members of Afomp, which are inside the committee, and I had something different. I am also in the same committee, and I don't know if I can consider as being kind of visiting professor at Chulalongkorn University to be included in the staff of Afomp. Anyway, this could be very important, and I will explain the reason a little bit later. Which are the Afomp plans? And probably our President Arun will explain better this point. There are plans to start a school virtual webinar lasting 2-3 days, each with 3-4 hours, on particular topics every month, in addition to the monthly webinars organized. But this requires planning, execution, and few devoted, enthusiastic medical physicists from the organization, and probably the first Afomp school will be held next June. But I want to express some point that could be matter of discussion. Well, we have a lot of webinar. In my opinion, many of the webinar, for example, the webinar which are given by IOMP, they are good for long life learning. What does it mean? They haven't the capacity to make a good training because the audience is not homogeneous, because they touch single topics. And so this is simply useful for long life learning. Why not to think also to lecture on fundamental of medical physics? I found a terrible spread between the what is taught in Germany, in Italy, in UK, and what is taught in some country in Asia. So probably if we have some regular, it could be to give lecture just on the fundamental of medical physics, about fundamental dosimetry, about everything. The other possibility could be to make webinars on selected topics. But anyway, they must cover all the spectra of the problems that you face in this topic, or some advanced topics. So we had to have clear idea which could be the target of our activity, teaching something to some other. And let me also, we can have different approach into which could be the faculty. Few external speakers strongly integrated into the local educational process. Yes, I like this. Or you need to have only some external speaker. And again, who select the advanced topics? What topics has to be covered? And I want to make another comment. On the left of the slides, you see what Professor Gu in Manila. I was present there. In Manila, he wrote and discussed these things. Medical physics in 2020 will we still be relevant? And he explained what happened a few years before 2008. I can put the same question. Medical physics in 2040, we will still be relevant? Mathematical modeling, computational skill, evolving modalities in diagnostic and therapy, radiobiological modeling, identifying, describing, solving problems, deep learning, artificial intelligence, advanced statistical method, and many other topics. So when Professor Volker mentioned the impact of artificial intelligence in the radiotherapy process, he was touching a very good point, because in very few years we will have that artificial intelligence, deep learning, and probably also augmented virtual reality could be used in our practice. And we will have a collapse between imaging and treatment. Why? Because during treatment, radiotherapy treatment, I'm thinking, you have the need to use quantitative imaging. And so you see how are our need for the future. Because if you are making training, you must take into account this. We are not looking at the past. We had to look to the future. And many years ago, I participated, 2004, guideline for education and training of medical physicists in radiotherapy, recommendation of an Estro Afomp working group. Okay, you see how many details. Many of the detail will disappear, but many will come again. And we need to have this one. When you are dealing with standard, we need to have at least a kind to regular approach. And I want to mention also another point. When we start with our duty, I mean the ACT committee, this one in 2018, some of them we were talking to create a different syllabus, but we have some problem. Unfortunately, problem with interaction between international organizations have in practice prevented this development. But we need to make it. And so why not to make a AFOMP syllabi? We can publish. Of course, the job is very hard, but we can publish and we can overcome the limitation we found 3 years ago to make our job. I stop here because I want to listen our president, Professor Arun, to draw, and probably he will touch also this point in a better way that I can make now. So thank you for the attention, and I hope to have some discussion with the audience.
Thank you, Professor Frank Milano, for your excellent presentations. And you have mentioned very few things which is very important at this moment. The webinar program, how we can be the generations and the coming generations will be benefited by these webinar programs. And there are, we know that everywhere the program is conducting in every organization, Afomp, Afomp, and all the national member organizations. So I think some question has been given to the Chogle sir. So will you speak now or will ask everything at the later moment?
When I start my talk, I will just answer into during that also.
Okay, thank you, Professor Chogle. So we'll go for the next speaker presentations. This is Professor Oru Chogle, Afomp president. Everybody knows him. And he will talk about the medical physics education, certification and accreditation of the program, which is very important at this moment. He is, over the last 36 years, Professor Chogle has contributed immensely to the medical physics education, training, research, professional development, and recognition of the profession in the local, regional, national, and international roster. He is currently Senior Professor and Head of Department of Radiological Physics, SMS Medical College and Hospitals, Jaipur. He is also President of Afomp, Chair of ETC IMP, Chairman of IMP Accreditation Board, and member of the Board of Directors IMPCB. He was Dean, Student Welfare, Rajasthan University. He was the board management in RUHS, member of the Academic Council, and also chairman of Unfair Means Redressal Committee, ex-president and MP. He was also pro-VC of RUHS. He is a teacher par excellence. He has done more than 100 publications in reputed peer-reviewed national and international journals and more than 300 research presentations around the world. And he has guided many research and for the PhD, MD, and MSc students. He has been the principal investigator for national and multinational research projects. He is the recipient of prestigious award in the year of 2020, the Afomp Outstanding Medical Physics Award. He was instrumental in developing paramedical science in the state of Rajasthan. In addition, he is fulfilling his clinical, academic research or educational responsibility. He takes care of his social responsibility very sincerely in terms of cancer awareness, early detection, treatment, and rehabilitation are the outstanding garnering national and international acknowledgement. He is the co-founder and co-editor-in-chief of the Hindi magazine, which is known as Mrityunjay, meaning conquering death, published in Hindi. Dr. Chubale organized national and international scientific meetings, teaching programs in medical physics, oncology, diagnostic and therapeutic radiation technology, and other medical radiation applications, regularly to disseminate education to the international best standards to the young professional in medical physics. He organized 17 international scientific conferences in Jaipur, and also the ICON RADEM, which is the International Conference on Radiological Emergency Management, and AOCMP 2017 under his chairmanship. He regularly organized IMDMP every year and IMPW celebration at Jaipur to impart awareness about the medical physics profession among healthcare professionals and general public. Thank you, Professor Untitled. So please, I'm giving you floor and requesting you to start your presentation.
Thank you very much, Professor Anupama, for your kind introduction. And I will be talking on, this is the ink. Okay, just I go to the mode. So first of all, delegates, I will be talking about the accreditation of medical physics education, certification of medical physics, medical physicist, special reference to the Afomp. Accept my greetings on behalf of Afomp, IMPCB, and IOMP for IMPW 2021. IOMP decided to launch International Medical Physics Week, somewhat similar to IDMP. There's a lot of noise.
Yes, please mute yourself.
To motivate organization of activities in a defined week that results in the promotion of the subject of the medical physics globally, increase the visibility and contribution of the medical physics as health professionals is a very, very important. If this COVID wouldn't have been there, we have arranged the rallies and other activities to reach to the public. As you know, IDMP 2021, the theme is communicating the role of medical physics to the public, and it's a very, very important. As last year's our IDMP theme was medical physicist as health professional. Education in a medical physics is a key to the success, and both the speakers, they talked about the importance of medical physics and also the changes they are taking place. Now, the Professor Franco talked about many subjects and all evolving. But as far as the Afomp is concerned, and many other ROs like Alfin or the FAMPO region, now many countries, they have not yet started the medical physics education program. And now the gap between the education and the curriculum required and not having is a huge. So you have to make it so that the students or the participant, they cope up with the syllabus. It doesn't become too heavy. It doesn't become too useless for the moment. And that should be seen about that thing. As another point he raised was Afomp, and we'll be starting the Afomp school soon on the basic, because many of the students or young medical physicists from the Afomp region, they need to clear their concepts on basics aspect. So I will go ahead with this thing. Due to increasing complexity of the treatment in diagnostic equipment, it has raised the expectation of the competency of the medical physicist so as to work in a healthcare arena, and therefore we need competent, clinically qualified medical physicists. IUMP policy statement 1 also makes medical physicists as the health profession, and therefore a need for well-structured, high-quality education and training program for a clinical medical physicist who can work independently as a specialist without the supervision, can take appropriate technical and clinical decision towards his profession activities was needed, and many countries they have started the medical education program. Now the question is, all these medical physicists trained by various universities or institutions fulfill these expectations of clinically qualified medical physicists to take care, work as a independently in a healthcare area? Whether the medical physicists trained by different university institutions competent enough to discharge their duties is to be seen, is to be assessed. How are we going to assess the education imparted, the training obtained by a medical physicist in one country or one university globally? So according to IAEA, to become a clinically qualified medical physicist, you must have first step a university degree in physics or engineering or equivalent this, and then appropriate academic qualification in medical physics, that is a post-graduation level of the order of minimum 2 years, and at least 2 years full-time equivalent structured clinical in-service training undertaken in the hospital. IAEA also states that it is emphasized that the holder of the university degree in medical physics without any clinical hospital structured training cannot be considered as a clinically qualified medical physicist. And therefore, education and training should be recognized by the national accreditation body. And how to do it, what are the things, and in a diagrammatic form, recommendation of the CKMPU by this IAEA document number 25. There's a basic degree of 3 to 4 years, then 1 to 3 years postgraduate degree in medical physics, and then 2 to 3 years supervised clinical training, that is called as a residency. After that, he can become a clinically qualified medical physicist. Medical physics is very dynamic. The technological innovations are taking, the competency should be again acquired with the requirement, and therefore you have to acquire the professional development, continuous professional development points, and that recertification is needed, and finally it should lead to state registration. Now, medical physicists work in many areas, in a clinical setting as a clinical medical physicist, as academia as a teaching, or in research, industry, accreditation agencies, standard organization, and many other organizations they work, and ILO has classified them as the health professionals, and other organizations like IAEA safety standard, basic safety BSA also says health professionals with specialized education and training, medical physicists are the health professionals. Now, IAEA IBS I talked about, I will not go into detail because many things should not be repeated again and again. So they are the health professionals. But as I said, the education must be accredited. The medical physicist competency must get certification. Medical physicists must get registration as the health profession like doctors, nurses, pharmacists, and there should be licensure system. So we'll see what is certification. Certification is for an individual assessing his or her competency, demonstration that an individual medical physicist is qualified to act independently without supervision. So certification is for an individual and assessing his competency. Accreditation is a demonstration that either the educational program or events where the attendee will be offered continuous professional development points or a certification board meets certain standards. So accreditation is of certification bodies or of educational program institution or the university program. And registration is registered in a certain regulation as the doctors or engineers, and licensing is you are licensed to practice your specialization like doctors, physicians, and nurses. So there is a certification for individual, accreditation for the educational program, and certification bodies, registration, and licensure. So what do patient and the society expect from their medical physicists as a health professional? As their professional competency, and by certification we assess their professional competency, education and qualification certification, problem solving, independent decision and execution, practical skills, humanity and compassion, and therefore certification is required. Medical physicists should have appropriate education and training. Medical physicist education and training program and event should be meet appropriate standards. Medical physics certification board should be capable of deciding if examinees have the required education, training, experience, so that he can carry his duties independently. If you look at the medical physics or medical physicist professional recognition, and especially in Afomp region, we have unclear job description, no acceptable certification, registration, license in many countries of the Afomp region. The job security, more so in this COVID pandemic, many of our medical physics colleagues have lost the jobs. Remuneration, there is no uniform remuneration in the region. Leave aside, in a country, remuneration varies from different institution to different institutions. Difficult to attract the best students into the, because of this, medical physics best students are not getting attracted. Substandard and mediocre people join, and that degrades the profession of the medical physics. Extraordinary people are responsible for rise of the profession. That is what we need. If they get job security, remuneration, and acceptable, and the respect is commanded and not demanded. Clinically qualified medical physicist, this IAEA Human Health Series Document 25 not only gives the roles and responsibilities, the education training, but leads to certification of the medical physicist and also registration of the medical physicist. That is what they say. This document says the process of certification should lead to that of registration, where records of certified professionals are maintained and organized in a form of database or roster by the government, by the Ministry of Health, Ministry of Education, or a recognized or subletted organization, the registry. What this certification accreditation is? Certification is a recognition of the knowledge of the professional who has completed the educational training, and accreditation is external assessment of the educational program. Now, just we'll quickly see the accreditation program, what they look at accreditation. When I'm going to accredit the educational program, medical education program of a particular institute or particular institution from the IOMP accreditation board, what we look at: status of the institution, governance, vision, mission, approach of the teaching and learning, level of international planning, the resources, and the competency that we see. And what does this accreditation program objectives are? Continuous improvement of the progress. It's medical education is not a static. Any education is not a static, as the technology is developing. And now Holker also talked about the AI. Now we have to be competent enough. Our education system should produce medical physicists which will be competent for the situation and for the future requirement. And that is what. So continuous improvement of the education program, curriculum, need-based, high-efficient graduate and postgraduate, correct and consistent evaluation mechanism of the student learning program, so that you assess and then they come out with a flying color and they can be absorbed. So for accreditation of the medical physics education program, we look at almost about 14 components staffing resources, physical resources, course program, and many other things. And then only the accreditation is given, and it is not a permanent one. It is given for 3 years. Again, we have to re-accredit it, re-evaluate, and then accreditation is given. The stakeholders are students, the institutions, the health professionals. If the health professional or the health institute is going to employ, they will assume that graduates of the accredited program have similar skills and that they have met required expectations of all entry-level practices. So there are stakeholders, professional, employer, state and federal government, society, students, and education institutions. So the accreditation of a medical physics education program is very, very important for all these stakeholders. IUMP has started the accreditation, and IUMP Accreditation Board accredits medical physics degree and postgraduate program, medical physics education and training institutions, centers, medical physics residency program, and education and training event. It has started accreditation of the postgraduate degree courses, CPD program, and residency program already. IUMP has accredited Masters of Advanced Studies in Medical Physics MMP of Trieste University and ICTP, which is being carried out, and Franco Milano is a teacher and a part of that thing. And reaccreditation we are doing. This was given from 1st November 2016 for 3 years. And also we have accredited 3 medical education program from Korea: Catholic University, Yonsei University, Cass University, and all these have been accredited in August 2019. The accreditation is valid up to July 2022. We give a certificate to each one of the institutions who are accredited from the IUMP. We put the list on the IUMP website. So internationalization of that medical education program takes place. You can attract more students internationally. We have also accredited CPD programs by the IUMP Accreditation Board, and these are the CPD program: Bangladesh, Sri Lanka, and the Germany, and even recently MEPOM virtual webinar was accredited, and CPD points were given for their program so that you earn the CME points. The details of the IUMP accreditation and manual are available on this IUMP website, and accredited program, everything is given at this website. You can visit this website, get the detail. You can contact me for the detail. Recently, IAEA has brought out the guidelines for certification of the clinically qualified medical physicists. This is TCS 71 document. Just in February 21, they have released it, and it has been endorsed by IMPCB and IUMP, and I was fortunate to be one of the drafting member of this certification guidelines. Every country, every institution can use these guidelines to establish the certification bodies. And in IUMP, this IAEA document, what does it mean, the certification for the reputation, the technology, for the medical patients and society, for clinically qualified medical physicists, for the health services, that has completely been defined. So even in certification, it is the patient and the society are stakeholder, the own medical physicist is at stakeholder, and health service provider are also at the stakeholder. Everybody gets benefited with all these things. And they have given the flow chart, who and how you can establish a certification board. If the country has got a medical physics association, they can establish their certification board. This certification board can be accredited by the IMPCB to certify. The entire flow chart is given Here, the TCS document 71 is freely downloadable from the IAEA website. You can download this thing, use this to make a certification body in your country. This gives you a visibility. This gives you the confidence. This leads to the registration as a health professional. So the ways and means have been given. If you do not have even the medical physics association in your country, because of the small number, IMPCB is there to certify individually the medical physicists, assessing their competence and those things. So I will just talk about the International Medical Physics Certification Board, IMPCB, which is established on the 23rd May 2010 with the goal was to improve the quality of the clinical medical physicist and the profession. The website is here, and I am the one of the board members, and it is associated with IOMP. This is a website. You can see, you have all the details. When are the examination, how to get the certification, how to get the accreditation of the national certification boards, bylaws, everything is there. This COVID pandemic, the examination are being conducted virtually. You have an opportunity, and next month they have a program to have examination for the medical physics certification. You can avail those opportunities. So International Certification Board, international accreditation is validation process to standard and status of the certification boards, serves the competent authority in accreditation of the national certification boards, set standards and procedure for the professional certification. Even they have conducted the examination for individual certification of the medical physicists, where the country do not have established certification board. So it is open for individual medical physicists also. So certification board IMPCB has accredited so far Korean Medical Physics Certification Board, Hong Kong Institution of Physicists in Medicine Certification Board, the Hong Kong Association of Medical Physics Certification Board, and now being evaluated, College of Medical Physics of India is being evaluated for the accreditation. Chinese Society of Medical Physics Taipei and Bangladesh Medical Physics Certification Board has expressed their interest for accreditation of their certification board. So IMPCB individual certification also does since 2030 by doing the examination. They are doing it. So far, exams have been conducted in Trieste at ICTP several times, at Dhaka, Prague, Mexico, Riyadh, Amman, Vienna, Santiago, Doha. They are being conducted. Over 150 candidates have started into examination process. 37 have completed all the 3 parts and got the IMPCB certification. Additional 51 are in process of giving the examination. And as I told you that now the pandemic has given you the opportunity that you need not have to go to a place where the examinations are being conducted, but online examination can be also given, and you can give individual certification. Now, just I want to come to the Asia Oceania Federation of Organization of Medical Physics, which was established in 2000, and we are celebrating 20th anniversary of Afomp. Presently, we have 21 members, 19 members, and 2 affiliated NMOs, and almost you can see 4.7 billion people live in this part of the world, 60% of the population. Now, problem with Afomp is that the area of healthcare is a very fastly and dynamic. The role of medical physics is becoming highly demanding as more and more countries are embarking on implementation of high-end medical technologies, and therefore we have to take all the steps to start the medical physics education. You cannot have the medical physics in a day or two. Even if you see 2 years, you need a post-graduation, then 2 to 3 years residency program, then only you give it. So you have to start looking to the future need. You have to start this program or ramp up your present capacity of medical physics education program. In next few slides, I will see what is the status of medical physics education in Afomp region, what is the need. A problem with Asia countries is that there's no binding force like a European directive, the European Union. So every country has their own education program, own standards and all those things. The harmonization of a medical physics education program, the residency is quite difficult. As I told you, Afomp hosts about 10,000 medical physicists in, this is one of the largest RO of the IOMP. We have various status of the medical physics in Asia, Oceania region, diverse cultural, social, educational, economic, insufficient clinical training programs are there, fewer qualified medical physicists are there, and they are migrating to the better countries like USA and USA. That is happening because there's a lack of recognition of the medical physics in many Asian countries. If you look at the country number of medical physicists, most of the medical physicists, they are working in radiotherapy. Very few are working in the radiology. And if you look at the population and number of medical physicists for Australia, it is 20 medical physicists per million population and as low as 0.56 medical physicists for Myanmar, and average medical physicists per million population in the Afomp region, which varies from 0.56 to 20 medical physicists per million population. Average is 2.67 or around 2.5, 11,000 medical physicists. Now, the medical physics education program, if you look at almost 16 countries of the Afomp have the medical physics education program. Some are 2 year, then in addition they have 1 year also and 3 year program. All 106 medical physics education program, they are running in the 16 countries of the Afomp. The number of medical physics education program institution, if you look at, India has almost 24, Japan has around 24, Iran has around 14 medical education program. Many countries, if you see, though, don't have, Myanmar, Mongolia, Nepal, Singapore, they don't have any medical education program yet. And many countries have less than 5 medical education program running in their countries. If you look at the number of students from these medical education program of 106, look, 865 medical physics physicists are or medical physics students are admitted every year. For demand is huge. To reach actually the requirement, you need to ramp up the student intake capacity or to start more medical physics education program. And you see that many countries do not have the MP residency programs yet. The courses are not accredited, and registration of medical physicists is only in 9 countries. So this has to be looked into, that we have to increase the possibilities of the registration, the accreditation, starting first the starting of the medical physics residency program and then accreditation of those things. And the number of students per year, highest are produced by India and Iran. Other countries, the number you can see is there is a scope to ramp up the number of students. Now we look at the requirement of on-job training and the certificate accreditation. Many countries, they do not have the residency program or the certification accreditation. And now we have the program in set for the accreditation of the medical physics education program from IOMP, IMPCB certification, and individual. So you should work on this direction. If you look at the number of medical physicists per million population, if you look at the US and Canada, it's almost 26. Afomp, if you look at about 12, and the Afomp is 2 to 2.5. So though we are much better than the FAMPO and Alpine or MEPOM, to come to this state, we have to ramp up our medical physics education program and intake capacity. Afomp is doing a lot, and they have brought out 6 policy statements, and they described roles and responsibilities of the medical physicists, the recommendation for the education and training, the ethics, the CPD program you need to acquire. So in summary, it is important that medical physicists become certified, medical physics education and training program becomes accredited, medical physicists in the countries that do not currently have certification accreditation program develop their own national program. Till that time, you can approach IOMP and IMPCB for continuous develop the expand their certification accreditation activities. In addition to all these things, for our theme is we want to become visible, we want to become popular, we want to become respectable. So some advice to the young medical physicists is that medical physicists should expand their horizon beyond the traditional boundaries of dosimetry, QA/QC, and planning. You have to come out of your the planning room, you have to come out of the GTV and CTV, reach to your colleagues at least in different departments of neurology, cardiology, other people, nursing staff, what you do and how you can contribute into the hospital in a different arena. Network with the important researchers of the medical physics, learn from the mentors, from the invited speakers, and from our colleagues. Interdisciplinary interaction is a very, very important. As Dr. Madan Rihani has stressed, that you should reach to your own other, health professional, other departments, interdisciplinary. Exercise leadership by leading activities, personal skill explored by the mentor. Fill in any gaps you may have. Paper publishing, master technical skill. Space to share doubts, insecurity for receiving advice. Support for members to space personal and professional mishap. So you have to come out. You have to give a helping hand, seniors to the juniors, and how you can expand, and then you can make yourself, you are visible, you are indispensable, you are very much required for the institution, for the hospital, for the university, for the society, for the patient. Then only purpose of this IMPW celebration will be fruitful. With this thing, I am very, very optimistic. There will be hurdles, there are limitations, there are problems, but I am very, very optimistic that there is light at the end of the tunnel. We will succeed. Together, we have to put on the effort. With this thing, I stop my talk and hand over back my floor to Anupama.
Many thanks, Professor Unchagle, for your very elaborate discussions about the certification process and accreditation process of the medical physics education program, which is very necessary for the Afomp region, especially for developing countries. Now we'll go for the question answer sessions. I think I will request all the speakers to show your videos, please. Jean Tians, I think you are here. Jean, are you here?
Just I'm coming back.
Okay. So my question to one question from Franco Milano, that what are the challenges we are facing, we are in ahead now? Franco Milano. Please unmute. Please unmute. Franco, please unmute. We cannot hear.
Is okay?
Yeah, it's
Now?
okay. Yes.
Okay, now it's you switch off. So there are terrible goals. And I want to mention other things that we forget in our discussion. Own call for action. Own call for action make the activity in radiodiagnosis very similar to the activity that we can have in radiotherapy. So, in my opinion, in the most exciting exchange is to form basic training, because what you need in many countries is to have 2 years academic. This means to know basic dosimetry. This means to know statistic. Then you can move to very difficult field when it could be the right time. Because think a little bit. If you compare a mammographic unit 10 years old and a new mammographic unit, tomo anyway, why you had to control kilovoltage? Why you had to control some so quality control is completely different. We don't need to make all the style test, and not all the country in the Afomp are ready to this one, because you have a large gap between the more advanced country and the less advanced country. So, in my opinion, you have to take the opportunity given by long distance training, and you can use external person which can dedicate some hour, not so many, but anyway, the organization can fulfill the gap that we have until now. This is, in my opinion, the measure exchange. And another point is this one, that in all the world, the accreditation is given by, not in Italy, the accreditation is given by the scientific society, which is very, very important. What does it mean? This means the scientific society must have the reputation and the internal audit to permit this one. Don't make some other authority to enter in the accreditation because they have no competence. This point is simply fair with many other. Estro defended strongly in the past that the guidelines must come from and the standard must come from the scientific society. So this is the tremendous job for you, for us, but it is number one. It is number one.
Thank you, Dr. Franco, for your nice elaborations. Now the question goes to Dr. Jean Chians. What about the frequency of testing of patient undergoing radiotherapy and also staff? It means the test means RT-PCR. Jean, are you hearing?
Can I ask a few minutes late? I will be
sure.
asking next question.
Okay, thank you. So next question to Professor Orun. Is there any relation between IOMP Accreditation Board and IMPCB?
IOMP Accreditation Board accreditates the Medical Physics Education Program, CPD program, and Residency program. it doesn't accredit the individual medical physicist. It doesn't certify. IMPCB is an International Medical Physics Certification Board. This certification board certifies the national certification boards, accreditates, also individual certification. Now, second question just I saw, is it valid in all countries? Now, if you look at the document of IAEA, which has been sent to all the member countries, is endorsed by IMPCB and IOMP. And in the flow chart, the certification process says that if you do not have the accreditation board, IMPCB can accredit you individually. That means IMPCB certification is valid. When does IMPCB give the certification? IMPCB gives certification only the candidate has a master's in medical physics, has a residency of minimum 2 years, and it is evaluated by examination, level 1, level 2, level 3 examination. After having passed, after having interviewed, then only this certification is given. So there are so many checks and counters. It is that without, if a candidate do not have a residency of 2 years, he cannot even appear for the IMPCB certification examination. Leave aside being him certified. So there's a foolproof mechanism and the steps the candidate has to undergo, then only he gets it. And this document of the IAEA regarding the certification, in me suggestion, it's a handy for you all to have your certification board in your own country. And as Franco Milano has said, it is your country's professional organization. For example, you have a professional organization, then you have a simultaneously a certification board, which is a scientific and has the norms, regulation, and by assessing the competency, first thing is his or her education and the competency, based on the examination, they will issue a certification. So these all things are after due assessment, due process is there. And on a IMPCB, it's a IOMP only started, but that's an independent body for certification of the individual and accreditation of the certification board. And on this IMPCB, IOMP has a board member to oversee the things.
Thank you, Professor Arun. Now the question goes to Volker Style. So it is recommended to have a long phase of transmission from R3D to IMRT.
Oh, how to answer that? If you have the possibilities, if you have the choice, let's say so. If you have the choice, I would say it's not really necessary. It's depending on your experience. But at the end, you replace the 3D conformal technique versus a intensity modulated technique with a better conformity and a better homogeneity of the plan. And at the end, the delivery times for the whole fraction are in the minute range, including SSR or SBRT. So all the interfraction and interfraction motion and these impact to the delivery are minimized. So if you can shorten this time as much as you can, but and if you otherwise you need, if you are fully focused now on 3D yes, you need a transition time because you have to get experienced in this new technique with the new quality assurance and all these new things. But at the end, you will end up with if you want to treat a higher number of patients with a high conformity and high homogeneous treatment plans, then you have to step out of the 3D techniques.
Okay, thank you, Kolkar style. Next question is Professor Orun. Is IMPCB certification acceptable in European countries?
That is what I just said. The document which IAEA has brought out, there it envisages that IMPCB certification is a way of certification and accreditation of the certification board. Now, this has to be accepted because of the internationalization of the thing. But it depends upon, again, the EU and individual European countries. I think Franco can answer this, or Holker can also give the answer. Eventually, it should.
Well, it's not easy. It's not easy to move within the European country. For example, there are some countries which can accept external medical physicists. I'm thinking to Malta. In Malta, we have Russian medical physicists and also Indian medical physicists, but it's just a local approach,
Okay.
Much easier to move for European within European country. And the reason is that we have the degree, the master in or bachelor in physics, and 5 years later we are medical physicists. This is another weak point in some country in Asia, that at the very beginning the entry level to the master is they are technician, radiographers. And this is weak.
Okay. Thank you, Franco.
Yeah.
Holker, do you have any comments?
Yeah, for example, I could tell you the situation in Germany. In Germany, the whole accreditation process is one of the duties for the authorities. So you have all the other things, the education, the training program, the content, and these things, they are very similar. But at the end, you have passed all your approvals to the local authority, and you give this and you give the license by the local authority, and that's the difference to other countries. So, and these local authorities, and this is what Franco said, these local authorities normally doesn't accept any certification from other countries.
Okay. Thank you, Folker. Jean, can you answer now? Jean?
Yes, I can. I'm ready.
Okay. So your question is, what about the frequency of testing of patients undergoing radiotherapy and also staff RT-PCR test?
I see. Actually, it's difficult to test the patients because most of the patients in the RT therapy was outpatients. So basically, we are control the test for the staffers. So we will have all the staffers will be get a vaccine injected. So, but even in this case, we will have a test in every 2 weeks for the staffers. But for the inpatients, the patients need to provide like a test within 72 hours in order to go to the inpatients. So that's most of the frequency.
Okay, thank you. You have another question. Can we deliver some low dose to patients with lung pneumonia due to COVID? If yes, then any studies have been done?
Yes, there's actually one study from American, I think it was last year, 2020 early. You can search for the low irradiation for the lung pneumonias for the caused by COVID-19. They actually treat 20 patients, and they got a response. Over 80% of the patients recovered from this pneumonia. I think you can search on PubMed. There's actually a study, but the dose was very, very low. The dose, I think, was only about 1.5 green or something. Yeah, there's
Yes.
actually a study, but we didn't do this. No, we didn't do this because we don't have actually in our hospital we don't have too much patients, and all the patients actually controlled by the whole hospital. We are not able to assess these patients, but they started on those irradiations.
Okay, thank you.
Can I add Anupama to these things?
Sure,
Yes, there are
sure, sure.
almost more than 10 clinical trials have taken place where the dose range from 0.5 gray to about 1 gray to chest. In India also, we did at all Institute of Medical Sciences this trial. Results are
Jean,
very,
will
very
you please mute? Jean, will you please mute? Okay.
Results are very, very encouraging, but question was practicability, because when you are going to take a COVID positive patient into a therapy machine, you need a dedicated therapy machine. Already we have a shortage of machines, patients are waiting. If a COVID patient has come and used for some other patient, the chances of getting infected, they were there. The logistic is a problem, but they have got a very good response that within almost 4 to 8 hours of that thing, the breathing and other parameters and the dyspnea got improved. But feasibility is another, practicability is a problem.
Okay, thank you, Professor Arun. Volker, how you are managing the COVID-19 patient at your hospitals?
No, this is not my basic, not my core responsibility. Everything is managed by the hygienic department, so I have no further details about that.
Okay. So I'm going to the question to Professor Arun. Will this accreditation and certification attract some monetary benefits to the medical physicists presently who are already serving in that pay scale, or only addition of the personal knowledge or degree?
Okay. Now, for example, the question I understood. Now you have basic qualification required to become a clinical medical physicist is MSc, Masters, and residency. You do PhD. That may not give you any monetary benefit, but the confidence, the hospitals, the credibility, that will increase. The day these are the things. Every country has got their own norms, and they are free to do that thing, isn't it? So this additional qualification, additional certification will enhance your confidence, enhance your professional value. That may lead to your wanting your promotion, and that may not be directly a money or monetary things. It cannot be like that, okay, you are a first class or second class, money will not be different, but the opportunity to get job, opportunity to get the promotion, and the confidence level of even patients and other things will increase.
Okay, thank you. The question to the Volker, this is the last one. This shows that artificial intelligence is now is a very hot topic these days, and many people would like to include their syllabus. So how you are thinking how the faculty are developed or staffs will be trained in case of clinical hospitals? Have you any opinion how we can overcome it?
Yeah, of course. The first thing is, let's say, it's pure mathematics and computer science. To say, okay, you need some basic statistic skills, computer science, computation science, and these things. And the other thing is how and this was my experience when we start with our AI projects. It was very important to have structured access to your data. If you want to use your own data, you have to deliver your own data in a standard format. So we had in this in our paper and filmless approach, we have independent access to DICOM RT data. For example, the delineated CT data sets. So we can based on these data sets and the cone beam data sets, we can deliver our data for those input. And but we didn't do any algorithms for that. So we did no development of algorithms. So it's a bit a different thing if you want to use it or you want to develop and want to do research on it. But you have to understand, if you want to use it, you have to understand what's going on inside. And this is why I said I see from the upcoming challenge is that you will get offered these artificial intelligence as a black box from companies and for the companies is a use case. So you pay for clicks per patient, per treatments, and so, but you are not the owner of the product. This is alone, yeah. So this has an impact on the whole financing thing, yeah.
Thank you, Volker. Maybe Franco would like to add something.
Yeah, I want to add something. I mentioned modeling. I mentioned modeling as a skill of the medical physicist. Why? Because application of data science, never mind any kind of application, artificial intelligence and so on, is a multidisciplinary approach. But modeling is the basis, because informatic people cannot know the detail of the physical interaction and so on. So this is because we had to renew the syllabus for the medical physicist. The syllabus which the agency proposed us is absolutely 3 centuries old. 3 centuries old. And another point, just because I'm talking, someone in the audience say, oh, very difficult task to have a common skill in all the country. At the very beginning, when the ATC committee start to work, Arun, Professor Bezak, and myself and me, we discussed to introduce different level in the accreditation. One basic level and one the desired level to permit to some country to grow up. But this is just on the table. I think that probably in 1 year, with some effort from everybody, we can face this problem.
Okay, thank you, Franco, for your good suggestions. Now we are at the end of sessions, and we have gone about more than 2 hours program running this program. So thank you speakers to have your valuable times to us, and all the participants, especially because you have joined from your work area. And I will request all the speakers that your advice, recommendation, suggestion is always very important for transfer knowledge in the Afomp regions. So we should have a good connections between us, and these programs topics covered in many arenas. So we have different topics like awareness, challenges, certification, accreditation, educations. So I think it will helpful for all the participants. I will before I will ask to Professor Chogle for the concluding remarks. I will ask all the participants to open your video so we can have a snapshots, And please open your video so we can have a snapshots of the programs.
Thank you, Anupama. It
Yes.
was a full program on IMPW week from the Afomp side. Very nice discussions we had about the challenges, the requirement of the medical physics education, how we need to adapt, requirement of certification, other things. Every country is developing in a different way. Unless and otherwise, you have a European Union, there is one guideline they have to follow, or country. It's not also the European Union, every country has to amend accordingly. The things are there, but many other countries or many of the world, they have their own way. Country has its own regulations, own status, socio-economical. So harmonization is going to be very difficult, but the step toward that direction that it will go. Disparity in the world will remain. It cannot, everything cannot become a harmonized one, but at least minimum required things has to be there. And as Professor Franco has talked about, we have started a discussion already, myself, Franco and Eva, with IAEA, that the curriculum, what they have devised way back, it needs actually the revision, and that will come soon. That will become a uniform thing to implement for each and every country. With this thing, thanking Anupama for excellently organizing and taking all the pains for this program. And again, she's taking because Afomp is organizing continuously the webinar. Since June 20, we have started, and now till 21 December, we have our program, which is available on the Afomp website. Afomp website, you please visit, a lot of information we'll have. Afomp has initiated a lot of programs. We have oration, we have outstanding medical physicists, we have best publication award in the journal. We are going to start best PhD awards in coming year. So we are trying to expand our activities and other things. Education cannot be put on hold despite of this pandemic. We are continuing, and as Franco Milano has suggested, the Afomp school will be starting soon on a particular topic, 3-4 hours basics, so that our members, anybody can across the world can take the benefit of that thing. They are free. Even the Afomp monthly webinars are free. They are all accredited, and every the attendance will get the 2 CME points. With this thing, should I, do you want to say something, Anupama?
Yes, thank you. And just you see in the screen, our next 12th webinar will be on 6th May 2021. I would like to request you to register in the program and to join.
Thank you. Then we just leave. Okay.
Yes, thank you all for the joining the session.
You are taking a photograph. All have done.
I have taken. And those please who would like to show, many of you didn't turn your videos. If you'd like to turn your videos, this is the last
video on, camera on. Yeah.
Yes, camera on, so we can have pictures of you. Yeah, thank you.
We can make a report and put it here.
Okay. Thank you for joining the session, and all of have a goodbye and have a stay live and healthy. Be healthy. Thank you.
Stay safe. Stay safe.
Bye.
Nice.
Bye.
Thank you.
Bye-bye.
Bye.